today, I just continue to think to myself, what a remarkable opportunity, but even more so a remarkable responsibility for us to step forward here today along with our folks here in Medina County. And that's something that's never been lost on us at Discount Drug Mart as we started the process. While product is extremely important, process obviously needs to be important, but what we really want to boil this down to is people. And that landed on me really in a heavy way as I'm seeing teachers and staff coming and going from the building this morning. So what a remarkable responsibility we have here today. Just to give you a little bit of background of how we got here at Discount Drug Mart, on January 19th we learned that we were going to be an activated Phase 1B age-eligible provider, which means all 76 of our community pharmacies, by appointment only, every hour, every day, every week, are taking care of and protecting patients against COVID-19 with a vaccine. We've been at that for roughly 14 days now, and we've already protected 30,000 Ohioans age 70 and up, something that we feel really good about. If you have an opportunity to see our process here in Medina or in Brunswick, you'll see that we're staffed with our pharmacists. Many of the pharmacists here today, specific to the school vaccination program, probably worked 12 or 13-hour shifts yesterday, taking care of what we're doing inside of our community pharmacies. Something, again, that we're very proud of. And no matter how good of a plan we put in place, it's going to boil down to our people and allowing our goals to be not only achievable, but sustainable. Specific to the school vaccination program, we've also been activated as a partner with the state and with the schools in that area. And this march that we're starting today does not impact the ground that we'll cover with our age-eligible population. And the state has a very intentional, very smart plan for covering ground with those that are age-eligible, in addition to now kicking off with the schools, but in a way that we're not slowing down our focus and the ground that we can cover with those that are age-eligible. So again, it's something at Discount Drug Mart we've been prepared for a long time, hopeful of the opportunity to help out in both ways, because this is something that we do as an immunization destination every year during flu season, as an example. When Superintendent Sable mentioned partner in the beginning, that could not be a truer statement. And I just want to say thanks to the state for presenting us this opportunity, to the local health departments that we've worked hand in hand with, to Superintendent Bob Plasko, who you'll hear some comments from, the Superintendent of the Medina County ESC, the host sites, Mike, the Superintendent at Brunswick, Aaron, the Superintendent here in Medina, and then all the superintendents across all the schools within this county that got us to this point. You know, leadership comes in many forms, and I can tell you that this group has been cohesive throughout. Cohesive in the way that more than one school stepped up to say, we'll be the site, we can do more, and I'm sure there's some other folks that would have preferred to be the site. But whenever we started to plan and we laid out what the options could be, I stepped away, they had a conversation, and in literally 30 minutes they came back and said, Jason, we want to get this accomplished at 2 sites. One will be Medina High School, the other will be Brunswick. So really appreciate the leadership of Bob and all the superintendents across these schools for stepping forward and in some ways probably deferring so that we can get this accomplished here today. Lastly, before I turn it over to Bob, I just want to highlight the fact that community pharmacy in general, not just at Discount Drug Mart, but specific to Discount Drug Mart, this is an opportunity to shine a light on the trusted member of your healthcare team that we can be, to remind everybody that we are the most accessible healthcare profession there is. So I think in many ways this will be a catalyst for community pharmacy to be able to do even more. With that, I will now turn it over to Medina County's ESC Superintendent, Bob Plasko.
Good morning to the media outlets joining us this morning. I appreciate Aaron, Medina, the Brunswick site, Jason, and everything they've done. I don't think it's hyperbole to call today an historic moment for Medina County. Today's clinics are the culmination of an outstanding effort of the Medina County Schools, the Discount Drug Mart, Medina County Health Department, and the Governor's Office. Can't begin to tell you the monumental time and dedication that these organizations dedicated to the end goal of making sure today was a successful event for our 3,500 eligible educators in Medina County. I think I can speak for all the schools represented at both Medina and Brunswick in saying that we're honored and humbled to be among the first in the state to receive the vaccination. And while we know across the state, counties and schools are working to get the vaccine in the hands of providers, I can only speak to the schools and districts in our county and point to the weekly conversations that we had since the outbreak in the spring with our health department and all the schools and the superintendents. The continual flow of information and the selfless collaboration from all the organizations allowed us to say from the very first conversations with the governor's office that we had a plan and we were prepared to roll out the vaccination as soon as possible. As with any plan, there is much continued work behind the scenes, and our sincerest appreciation goes to Discount Drug Mart for working hard to get the registration and scheduling as seamless as possible for a large-scale event today. Earlier this week, the eligible educators received that scheduling link for today's event that commenced at 7 a.m. and will run through 5 p.m. this evening. Our host sites have done an amazing job providing a convenient location and in working to ensure that all safety precautions were in place ahead of today. And while we're excited, beyond excited quite frankly, that we have the first phase of the vaccination here today, we're equally excited that our work to convene a one-day vaccination clinic means that Discount Drug Mart can resume providing those vaccinations to other eligible groups. And ultimately, while we know educators across the state have worked tirelessly to provide the best possible education for their students, we know that for today, or for Medina County, today's event is one more vital step in getting and keeping our kids in school. Thank you.
Good morning, my name is Amy Busby and I'm the Communications Director for Medina City Schools, and I want to thank Superintendent Sable, Jason Briscoe, and Superintendent Lasco for all of their comments today. At this time I'd like to open the floor to our media friends and guests and open it up for questions. The superintendents could walk forward.
I guess so. Of the 3,500 total that are getting vaccinated today, what kind of, do you know the rough percentage of what that is of your full staff? You know, kind of what your opt-in percentage number is?
Yeah, so that's a good question. Across the state, what the governor's office had indicated was the average was 65 to 70 that they were seeing early on. In Medina County, we neared 80%, which is certainly a really good number and a target that we certainly hoped for all along.
Why is that such a big deal since that's so high? And if I'm not mistaken, all the schools are back in person kind of 100%. Why is it so important to have so many people get the vaccine, so many educators get the vaccine?
I think there's a scientific research behind it showing that in that range, I think, and Discount Drug Mart could probably answer that a bit better. I think for us, it's just an indication of the dedication and trust that the educators put in Discount Drug Mart in the schools, and their willingness and just to basically make sure that we're doing everything we can to keep and get kids in school. All along, we've been very fortunate in Medina County, and this is again just another indication of what our educators are willing to do to keep themselves safe, but keep the kids safe as well, and keep them in school.
What went into that decision to resume in-person instruction among so many of the districts, in January?
So that's a really good question, and I'm going to defer to one of our superintendents who made that decision.
You know, it's been very challenging over the course of the past year in regards to making decisions as superintendents because the safety and the health of our staff as well as our students is a top priority. We're fortunate to have a very collaborative relationship across the county as superintendents. We had weekly meetings, sometimes even more than weekly meetings, which included the health department. And we had discussions about what's best for our individual districts. We all didn't have the exact same plan because we all have different districts, different facilities, different amount of students. But it really was through collaboration taking a look at the state level data, research done by Ohio State regarding the potential spread of COVID in schools, as well as our own information and data that we've been keeping throughout the pandemic. What we have seen since January is little to no spread within the school. The cases of COVID that we've experienced, vast majority have occurred outside of the school district. Our staff, our parents, our students have been very responsible with their approach with COVID and followed protocols with morning health checks to make sure that COVID was not brought into the schools. Strict standards and COVID protocols have been in place all year. And honestly, our students are just unbelievable. The adaptability that they've had during this difficult time, whether it's wearing masks all day, staying 6 feet apart, or learning online, they've done a great job, and they're a huge part of the reason why we were able to bring everybody back. So the lack of spread within the schools, the need and balance of education versus safety, that led to the decision to bring our students back.
Another quick question while you're at the podium, you can hear me. How does today, if at all, change any of the COVID protocols that you already have in place?
It doesn't. Despite the vaccinations that are occurring today, our COVID protocols will remain in place just as they've been for the entire school year, and that's actually very important. I'm not a scientist, but watching the media, vaccination doesn't necessarily prevent the spread of the virus, and we need to be conscious as well that despite our staff is fully vaccinated, that's not the case for our students. So safety will continue to be a priority.
Jason, I have a question for you. You talked about the pharmacists from Discount Drug Mart being here today. Who is actually administering the injection?
And our pharmacist. So in the state of Ohio, we have protocols in place that allow pharmacists to administer all vaccines in accordance with what ACIP guidelines. ACIP is an offshoot of the CDC. In many ways, that's a big win for pharmacists, and it has been for years, but also for the public, because what more accessible place is there to stop by and be protected against a preventable disease, and whether that's with the flu or pneumococcal or shingles, in this case COVID-19, it's our pharmacists that are administering the vaccines. Yes?
Are you administering the Moderna vaccine?
So any dose that comes into the state from the feds is a good dose, and any dose that gets to the state and down into the counties and in the hands of providers is a good dose. But specific to your question for here today, it's the Pfizer vaccine.
Oh, today's the Pfizer.
Yes. That was some of the uniqueness about our capabilities at Discount Drug Mart is we have protocols in place that allows for the ultra cold storage and handling and administering and reporting of the Pfizer product. So that gives us flexibility when maybe other providers don't have. But if we have access to the Pfizer or Moderna at Discount Drug Mart, we're able to take care of both.
Does that need 2 doses with Pfizer?
Yes, sir. So both vaccines currently are a 2-dose series. The Pfizer is in a rhythm of the first dose, followed by no less than 21 days that pass, and then we would be able to schedule that second dose accomplishment. Same concept with the Moderna, except the rhythm is 28 days beyond the first dose.
Right, so today is obviously a massive undertaking. Will this have to be replicated in 21 days?
Short answer is yes. Now we'll get with Bob and the superintendents and we'll do a after-action review to see if our design and our workflow and our setup was effective and if it accomplished our goals. And if it did, then we'll go for it again no less than 21 days from now. But we will be partnering with them throughout the process to ensure that we don't just cover the first dose, but we get the second dose accomplishment as well.
I have a question for Bob. Why was Medina County picked to be one of the first counties to administer the vaccine?
I'd go back to my statement, and we're just humbled and honored that we were one of the first. I can't speak for all the other counties across the state, and I know educators and those counties are working tirelessly, just the same as we did. But I think I would point to the collaboration and the weekly communications we had. There was a flow of information from the beginning, and we were already developing what we wanted to do before all of this was rolled out on January 19th. So when we had those first conversations with the governor's office as an educational service center, and they rolled it out across the state for ESCs to be the ones to contact the schools and collaborate and convene these clinics, we said, we've got a plan, we're ready to go. And there were varying stages of that across the state. I can only speak to Medina County, saying from those first conversations with our group, we were ready to go. And I think that was the key point there.
What's the value of having everybody in the county come through in one day, as opposed to doing it in the way other districts have, where individual districts do their own thing in their own schools? Jason and I were talking about how this is kind of a Super Bowl of vaccinations in Medina County for educators today. Why is that a good option for you guys?
I think there's a lot of good options, and like Jason referred to, we had that conversation. We had a number of different options, and just at this point, and as an educator, it's always kind of taboo to say, well, one more day off of school isn't going to matter for kids at this point. But this year, quite frankly, one more day off of school to get this done in one day and get educators back on site, that was a component of it. The other part of it was making sure that we could get work with the governor's office, get that flow of vaccinations, make sure that they weren't going to be reaching any shelf life or any issues with traveling to the districts. We have a wide range of schools and districts in Medina County, and it just made sense to convene them at one site and be able to get this done in one day and get back to educating kids.
How do you go about figuring out a threshold to potentially returning to remote or hybrid instruction if you need to, if Medina County sees a spike, even if it's not in the schools, but just if we see those community numbers go the wrong way?
So I'll start to answer that question, but again, I'll defer to Superintendent Sable. I think it's those weekly conversations. We're continuing those via Zoom. We'd love to be back in person, obviously, but weekly conversations via Zoom with the health department, with Jason throughout this, just all that data that we can get in to make those educated decisions. And the superintendents, they know their communities, they know their needs, and know what's going on in their schools and the data. So I don't know if that completely answers your question. If it doesn't, I defer to Superintendent Sable.
Well, and I guess one thing I wanted to touch on is we've been following like broadband access and things like that. Like, did you guys think that the remote, your remote hybrid time, was that successful? Did you run into connectivity problems? How much did that drive, the steps to come back in January?
Mr. Sable.
In regards to your first question, there's not an easy answer. There's actually multiple data points that we review in making those decisions. I can tell you that the biggest challenge that we have had is the quarantining of students and staff, and not having appropriate staffing levels to really run a building. We've been fortunate to be very successful with the online instruction. So that's allowed for there not to be a very big gap in our students' education. But really, it's staffing. And the governor recently made some changes to the quarantine procedures in schools, because we do have such strict COVID protocol in place, which we are already seeing a decrease in quarantines, specifically in schools. And I'm hopeful that that's going to help us to stay open.
So that you could draw a direct line from more vaccine, fewer people sick, better staffing.
Absolutely.
Yeah, okay.
How are people scheduled today? Is it like a chunk of people at a time, or individual teachers signed up for individual half-hour periods, or?
No, that's a good question, and I've said all along this, as superintendent, this is my first pandemic. It's also my first vaccination clinic. Our partnership with Discount Drug Mart was just absolutely essential in this process. We did coordination and communication within our district. Discount Drug Mart coordinated and organized the signups. So any educator or school personnel receiving the vaccine today signed up through an online sign-up system for a time slot. And it's gone very smooth. This morning at 8 o'clock, I checked where we were at, and by 8 o'clock we were already about 15 minutes ahead of where we were scheduled to be, which is quite impressive with the amount of people that we're bringing through our gymnasium today.
I can add a little bit to that as well. So specific to the registration process, which dovetailed into our scheduling process, Superintendent Sable outlined that extremely well. So here at Medina High School and as well as Brunswick, we essentially identified all the individual school systems who would be pointed to one event or the other, again hosted at Brunswick and Medina. So each of those school systems received a link to then allow their folks to register. So their not last chance, but kind of a more firm final total of individuals by school that we know would be coming here for vaccination. And once we had that final total, we then worked very close with the schools in making sure that nobody was left behind, meaning if they missed a deadline for registration, we got them across the finish line. But once we had a pretty good hold on that final registration number, then we sent an individual invitation to all employees across all schools to then select an appointment. So the first person to open the link would have a global view of all the appointments that were there. The last person would have less options. But those appointments were in coordination with the workflow we needed to create today to allow for a natural physical distancing and the throughput required to get through 800 educators and staff today here in Medina and roughly 1,500 over in Brunswick. So we started with the idea of what will it take, number of pharmacists, number of vaccination lines, number of appointments that match that, and then everybody, we started the process here at 7 a.m. this morning, and it just kind of flows naturally with that appointment-based system to align with the workflow necessary to get through our day. Yes. Oh.
Yes, so you said that you really have a two-pronged approach. One is with the students and the educators, and then the other is with seniors. For seniors that have registered on the Drug Mart site, about how long can we expect, if we're in the eligible age, to get notification to sign up for an appointment?
Absolutely. So specific to the age eligibility march inside of our stores every hour, every day, every week, our scheduling system aligns the priority groups with the available vaccine. And we all know right now that demand far outpaces supply at the current time. But like I mentioned before, in just 14 days' time, we've already protected 30,000 Ohioans. So to answer your question specifically, it depends on the primary location the patient has selected with the number of doses that store may have at that time. But we have some sophistication in the process, meaning that if an 80-year-old person who registered from the jump, knowing the priority is 80 plus followed by 75 plus 70, that 80 plus person would have the opportunity not only to go to their primary location, but within the mileage they're willing to travel at any other discount drug mart. So we're very mindful of making sure that everybody that wants to be vaccinated will be vaccinated, and they'll be vaccinated in accordance with what Ohio's guidelines are specific to the phased approach. So it's hard for me to say how many days post-registration we would have you across the finish line, but that process has been very efficient thus far.
The exact numbers that are going to be vaccinated here today?
I don't have the exact, ballpark. I believe it's close to 3,500 total, 18 to 1,900 here at Medina, 13 to 1,500 over in Brunswick.
I just had one question for either of the superintendents. Are there any teachers or other employees who maybe had a pre-planned vacation or some sort of a leave right now today? And if so, how do you plan to get caught up and get them vaccinated?
We actually had that at the ESC, and I can't speak to the specific schools, but I said be there, find a way to be there. Half in jest and half not. I mean, this is an important day, but at the same time, we understand people are either in quarantine, don't meet the requirements for getting the vaccination, maybe still have symptoms from COVID. had something pre-planned. So each school has maintained a list of those people who, for whatever reason, registered or wanted to register and were eligible and couldn't be here today. And we're working with Drug Mart to either do a follow-up event or capture them when we do that second round of vaccination. So they still maintain their eligibility. It's just a matter of getting them in here in that appropriate time.
Were there any incentives or penalties for teachers who chose either to get it or not to get it?
Not whatsoever, no. There's no penalties, no incentives, other than it's a personal choice, and we told them that from the beginning. There's been no discussions of requirement. I can't speak to all the schools and internal discussions, but in terms of requiring it, we haven't heard that at all. It's a matter of this is an opportunity that we're providing and presenting to you, and I think the schools have done a monumental effort in not having students here today to make sure that anyone who wanted to get it could get it.
If there are no other questions, this will conclude this portion of the press conference. With that, I'd like to thank Brunswick City Schools as well as everyone here at Medina City Schools for hosting this event. Certainly this is a very historic moment and that we are witnessing today. So I would like to now invite all of the media to follow me. We have a staff member. She is a middle school physical education teacher who has volunteered to receive her vaccine and have you join her in that moment. So if you would,